would say mental health is really your mental, physical, and emotional well-being. To me, it's all sort of packaged together.
Peace and equilibrium amidst chaos.
Just like we talk a lot about physical health, and there's a continuum from, stubbing your toe and having a little bit of pain all the way to having some really serious conditions. I think mental health is an umbrella term just like that.
When I hear mental health, it makes me think about someone who is in a good space mentally, spiritually, psychologically, and even physically. I see it all being tied together, so that person is well.
Let's say you get old timers and you don't know exactly where you're at or who you are or who you're talking to and all that kind of stuff. Mm-hmm. So it's very important to try to keep your mind very healthy, and one way to do that is take your medication, whatever the doctor prescribes for you, and let him make sure that you're doing everything that you do.
And some people just, it's like a section between sane and insane.
At the beginning, when the gentleman says, you're in between sane and insane, sort of like there's no middle, you know what I mean? Like you're either sane or you're not. And I just found it very interesting that that's the way a lot of people think.
We were talking earlier about this idea of kind of the polar opposites. You're either sane or you're insane. And there's an awareness element that there's a whole span in between those. And you're not on either the edges, that, people range, and it changes, that one day you might feel really dark and another day you might feel okay, and that's normal.
One of my big takeaways was people don't have the language. So I think this mental health literacy is critical. Just helping people understand the range. They're on a spectrum. And I think that's what we need to tell people. And as someone's already said, it's situational. Like one day you can feel really depressed, but you get a good night's sleep and you wake up and you're like, oh, I'm a new person. But you could have anxiety one day and less the next day. Like we're all on this spectrum, this mental health spectrum. And I think that's what we need to normalize.
We talk about, are you healthy? Well, we don't have a vocabulary for that for mental health. Like, are you mentally healthy? And, we have, it's so common if we ask someone, how do you stay healthy? You know that sleeping and eating right and exercising and, taking your medications are things that are just part of being healthy. Well, we don't have that same vocabulary for being mentally healthy.
I think that first it's figuring out what the levels are, or what's good mental health and what's bad, and being able to say, almost like that spectrum scale, here's a happy face and here's, like it's in between as well. But that's what it made me think of, is you can't really change the terminology until people are comfortable understanding that if you're sleeping in and it's not normal for you, then you may be sad.
People just need to feel comfortable sharing so that other people can see it's not just me. In the Black community, we don't talk a lot about mental health. Why is that?
This is my first opportunity that I've come across someone who is talking on mental health.
Really? Do you think we should be talking about it more?
Yeah, very essential, because it's important.
Personas que no escuchan a las personas que hablan, ¿me entiendes? Hay personas que hablamos, pero otras personas no nos prestan atención.
They don't want you to think that they're crazy or insane and things of that nature. They want to basically feel that they're okay and they don't have any problem, nothing is wrong with them. But they can't help themselves if they don't go and get the help that they're seeking, and I think that's important.
I think because quite often it's been seen as a sign of weakness, and yet the reality is that if you're human at different points in your life, you are going to have stresses that make you maybe a little bit more emotionally unsettled. And I think, to be quite honest, not only is it because it's not necessarily looked upon favorably, but also because quite often when you go to places and you try to gain mental health services, you're not actually necessarily able to access the services that are necessary. So I think a combination of stigma, shame, and lack of access.
I'm always struck by the sense of stigma and shame that people talk about when they talk about mental health. It seems like they know kind of what they should be doing, that they should be talking to the providers about it, they should be eating well and sleeping well, but there's still this stigma and shame around you need help and that you may be having trouble.
You heard some of it, sane versus insane, or she's crazy, or he's got screws loose. The language people use on the grapevine around being mentally unwell is just not very kind. And so I think the other thing we can do is try and shift that language. But it's very hush hush. It's like, I heard, did you hear what happened to so and so? But it's not in a positive, supportive way.
People don't know how to deal with it. And I think that's part of the issue, is that when you do bring up, like I had another influencer who was saying that he's a big football player, right? And so when he went to his friends and was like, you guys, I think I'm depressed, they laughed at him, right? They were like, you're not depressed, come on, let's go do this. And then he ended up going to his mother, and she was sort of like, okay, but I don't think I'm the right person to help you, right? So this person now has asked 2 groups of people for help. And then, so I think it's almost like an educational thing across the board of, how can you help someone, even if it's just directing them to the right place, or, what are the levels of help? Because I think that's what, with that stigma, there's a generation who believes, and who you're not going to change how they believe, right? They believe that mental health is a specific way. And so how do you alter that? Or how do you at least just give them the tools, I guess, to help someone or to be helped?
One of the things that I've been really interested in is how technology can help support education. And, with a lack of awareness, a tool that I was looking at the other week was a tool created specifically for families of patients who have more severe mental health issues. And particularly it was for parents working with children who have mental health needs. And part of what we were seeing is that parents don't know what to do. They don't know how to interact with their kids. They don't know what to say. They don't know how to help. Melissa, to your point about, how do you talk to someone who's having a panic attack? And what was really cool about this tool was that it showed different options. And, here are some scripts you can use. And here are, here's some information so that you can teach yourself about it, so that you're not putting that burden on the child. And, those kinds of things, being able to share information. Something from the video that I thought was so interesting was when, Dr. Lisa, you were asking about, where do we put this information in? Does it go in books or in the fitness centers? And partly it's like we want it everywhere. We want these little bits of information so that people start kind of picking up some of the language. They start picking up some of the tools, even just some ways to talk about it.
Imagine you walk into the laundromat, and as you're opening the dryer, there's a note on there that says, have you done one of these things for your mental health today? It's just like the guy said, it's just not talked about. It's not front and center. And that's why people think it's bad. Maybe we offer them a menu and say, here's a holistic solution. You can pick whichever one you want. And then no one has to know that I'm calling the mental health service.
It would be interesting to geo-target, right? So like if you were, this is very simple, but like by a cemetery, right? And you could actually have something pop up on someone's phone, are you sad? Are you needing something? Or, you know what I mean? If they're by school, do you feel stressed? Do you feel, so that you actually, like you just said, you're giving people the answers where they are. And maybe if they're not, they swipe one direction. And if they are, they swipe the other, make it like really simple, so that then you give them the text line, you give them, whatever it is. How could we almost create like a community app where you're kind of, you know what I mean? Like people are connected in some way where you can, almost like the pod idea, right? You have all these people together and like you're almost watching out for each other.
I think if we offer tools for mental illness or mental disorders or anything related to mental health, we have to find a way to frame it or market it so that it doesn't become, oh, well, that's the tool you use if you're going insane, or that's the tool, you know, if you're schizophrenic. It has to, we need to reframe this as mental wellness.
We have so many applications that track your physical health. So you've got your Fitbit, you've got your Apple Watch, but we don't have ones that really help with tracking your mental health in a way that brings it all together, right? So I have an app that every day it asks me how I feel, and it gives me, 10 smiley faces and variations, and I mark it, and I love it. But it doesn't tie it to other things that I'm doing in my life. So it's not tying it to my diet. It's not tying it to my exercise. It's not tying it to, what my stress levels of the day, so that I can get a more holistic picture of how those all things are connected.
Yeah, it would be interesting, like for the, you were saying the Apple Watch or whatever, where it tracks your sleep, right? So if you're sleeping 8 hours and it knows you sleep 8 hours, it has your average, and then all of a sudden you start sleeping 12 hours, then where it could like pop something up and say, hey, how you feeling? Or I almost think like it would need to be simplified to the sense of like, yeah, like almost when we were talking about the happy faces, like I don't feel well today. And then it would give you options like, well, almost choose your own adventure. Like, oh, you don't feel well today, then maybe you could try this, or have you tried breathing? I mean, I just think a lot of those things, I have anxiety, and I know that one of the biggest things for me when I'm having an anxiety attack, because I have huge anxiety attacks, that's when people tell me just to breathe, it makes me crazy, right? Like you don't understand what I'm going through. And so if you tell me just to breathe, I'm like, okay, like step out of the way. So I think that it's realizing where people are and what really could help them in that situation. If you're having an anxiety attack, you feel like you're having a heart attack.
One of the things that is so critical here, and that I see as one of the constant problems, is that as health systems, we're often coming up with these point solutions. We've got this thing if you have depression. We've got this thing if you've got anxiety. And this is what you have for if you're thinking about suicide. And part of the problem is that we throw our resources at people and expect them to figure out what's right for them. And it really is, I think it's such a critical point that it's partly our job, and technology is a great way to do this, to figure out how do we get the right thing to you at the right time. And we need to take on that burden of helping them figure out the right resources. We can't just give them 10 things and say like, go figure it out on your own. People are not going to do that. I barely do it, and I work in this field. It's not easy.
It is such a daunting problem. But I think it starts with addressing the stigma and improving the mental health literacy. So just helping people develop the language to talk about it, and because that'll help destigmatize it.